Hey there, everybody. Hope your summer is going great. Mine's going fantastic. Um, okay, so for this body system presentation, I chose the metabolic system. So, a little bit about the metabolic system. It's basically a series of organs from different systems that work together to perform multiple processes like metabolism, excretion, regulation, and balance. So, a few major organs involved in this system include the liver, the kidneys, and the thyroid. So, like with every system in the body, there are changes that occur in the metabolic system due to old age. So, we'll get into that. The first thing I want to talk about is the function of the liver. So, normal functions of the liver include filtering blood, secreting bile, detoxifying chemicals, etc. And over time, that blood flow is reduced, causing an increase in medication half life. So, this means that medication stays in the body longer and can accumulate. And the liver, as we know, is the primary site for drug metabolism. And a few examples of medication that can accumulate in the body to reduce or due to the reduction of normal functioning of the liver include NSAIDs and acetaminophen. So, as we know, someone taking NSAIDs regularly are at risk for bleeding. And an accumulation of this drug would be especially dangerous for, well, anybody, but specifically for the geriatric population. And while acetaminophen is recommended over NSAIDs, it's metabolized primarily in the liver, and an accumulation of that would cause liver damage and liver function to steadily decrease. And then moving on from the liver, I want to talk about the kidneys. So the liver is the primary site for metabolism of drugs, and the kidneys are the primary site for excretion of those drugs. And by the age of 80, kidney function decreases by 50%, which means drug excretion takes longer. And these effects are very similar to the liver. The glomerular filtration rate is reduced as a result of aging, which increases the half-life of the drugs. So half-life is increased in the liver due to old age and also in the kidneys. And kidney function can be determined by calculating the creatinine clearance, which decreases as a person ages due to a loss of lean muscle mass. Blood flow is also reduced in kidneys, much like the liver, at a rate of 10% every 10 years. And lastly, the kidneys help regulate body fluids and electrolytes. And this regulation can become compromised over time and with old age. And because of this, renal insufficiency and renal failure are more prevalent in the older generations compared to that of younger generations. And then moving on from the kidneys, we've got the thyroid. So, as we know, the thyroid is part of the endocrine system, but it also plays a role in the metabolic system. And a few minor but normal changes that occur as a result of aging include atrophy. Over time, thyroid becomes smaller, fibrosis, which is a thickening of the thyroid, and inflammation. And in older adults, the functions of the thyroid diminish. For example, hormone secretion is reduced, including TSH, T4, which is thyroxine, and T3. Changes in thyroid functioning can be hard to detect sometimes in geriatric patients because many of the signs and symptoms are a normal part of the aging process. So a few assessment findings that we've already kind of talked about, but I'm going to break them up into more of the assessment part of it, are hormone secretion, metabolism, and excretion. So with hormones secreted by the thyroid, age affects the TSH. So TSH is actually increased over time and then T3 and T4 are both decreased. Old age also plays a role in metabolism, as we've already discussed. The metabolism of drugs specifically by the liver in that function is decreased, resulting in accumulation of the drug and damage to the liver over time. Excretion in older people is also slowed. We've already talked about that when it comes to medications. And then fluids and electrolytes are also affected by excretion, whether they're excreted in excess or not excreted enough. So, talking about fluid and electrolytes in that previous slide, we're going to specifically focus on fluids and electrolytes. So, in all persons, it's important to have a balance of fluid and electrolytes. I'm going to say that a lot. But we're specifically focusing on geriatric patients because this is gerontology. So two electrolytes that are affected most by old age are sodium and potassium. Now, hypernatremia and hyponatremia are the most common electrolyte imbalances in older people. And this is because of that lean muscle mass loss. And it's also due to a decrease in total body water, which I'll get to a little bit later. And then hyperkalemia is also a common imbalance due to a lot of medications that are prescribed for older people. So, for example, spironolactone is a potassium-sparing diuretic, and ACE inhibitors, which are used for blood pressure. And then going back to what I mentioned about total body water, it's decreased. So it's actually pretty normal for a geriatric patient to be in a slightly hypovolemic state. And then obviously, kidneys play a very large role in regulating these fluids and electrolytes. So when the kidneys aren't functioning right, fluids and electrolytes are not in sync with one another and with the body. So these next few slides are going to be about three major disorders or diseases in the metabolic system as a result of old age, or maybe their signs and symptoms are different because of old age or worse. So we'll talk a little bit about that here. But the biggest one that I want to talk about is diabetes. So type 2 has become more prevalent in the older population in recent years, most likely due to sedentary lifestyle, poor nutrition, and then with old age, we obviously have a decrease in organ function. The onset of type 2 diabetes comes with very few symptoms and in some cases can be totally asymptomatic until the damage has been done and it's irreversible or a sudden event occurs. Some early signs of high blood sugar, there aren't very many. I just have two listed here: dehydration and confusion. And then a few significant considerations. Wow, English is hard. For hyperglycemia pertaining to older generations is a tolerance for high blood sugars. So it's pretty normal for an older person to have a fasting glucose level ranging in the 200s or even higher. And while hyperglycemia is definitely something to keep in mind, hypoglycemia is also very important to monitor. And some early signs of that include tachycardia, tremors, pallor, diaphoresis, and then a few later signs are headache, dizziness, hunger, fatigue, etc. We've learned a lot about diabetes this past year, so that's just kind of a really quick overview of some considerations for older people. And then moving on to renal disease. Chronic kidney disease is a progressive illness, meaning it occurs and worsens over time. We know that. And if the blood isn't being filtered like it should, the rest of the body becomes affected as well. So there are little to no early signs of renal disease unless you have regular lab work done. And as fluid builds up over time, it causes edema, and this is a pretty good indicator of the kidneys not functioning right. A few late signs of renal disease include fatigue, changes in urination, so whether you're needing to use the bathroom more frequently, or maybe you're not going as much as you used to. Another set of symptoms are weight changes, so unexplained weight loss or even unexplained weight gain. And because this is a chronic and progressive illness, there are few treatments, one obviously being kidney transplant. You replace the sick kidney with a healthy one. And then another is dialysis, but that usually occurs in advanced stages of renal disease. So treatment kind of builds up to dialysis. The last one I want to talk about today is hypothyroidism. So hypothyroidism is the most common thyroid disorder in geriatric patients. And the onset is pretty subtle and develops slowly, making it more difficult to detect, especially in an older person. And hypothyroidism is thought to be caused by chronic autoimmune thyroiditis. So autoimmune, obviously the immune system is attacking the body. In the case of autoimmune thyroiditis, the immune system is specifically attacking the thyroid, which causes hormone secretion to diminish. An example would be if lab work shows an elevated TSH level along with a decrease of T4, aka thyroxine. This can be an indication of the body overcompensating for the thyroid's inability to secrete hormones at a normal rate. So, now that we've said all that stuff about metabolic system, here are a few educational points, and most of these pertain to diabetic patients, and then there are a few that are kind of just in general. So the first, obviously, for diabetic patients, it's especially important for anybody of any age, whether you're 65 and up or you're 21 years old. It's important to check those blood glucose levels regularly. And it helps you determine if your blood sugars are high or if they're too low. And also, it helps regulating that blood sugar helps regulate other body systems and can reduce the risk of injury both internally and externally. And moving on from that, kind of moving away from diabetes for a second, because of diminished functioning of the liver and kidneys, it's also important for geriatric patients to know how much of a drug they should ingest per 24 hours. So for example, in the book, it mentions Tylenol. And it says that 3 grams of Tylenol in a 24-hour period is the maximum dose for an older adult. However, if someone were to take extra strength Tylenol, that maximum dosage is reached much quicker. So if you have a patient taking extra strength Tylenol, they would take less in a 24-hour period than somebody taking regular strength Tylenol. And then moving on to that fluid and electrolyte balance, while it's important to determine fluid and electrolytes, whether they're in balance or not, one electrolyte specifically sticks out to me, and that's potassium. We've heard so much about it. Never push potassium. And it has so many effects on really important body systems, for example, the cardiovascular system. And in the book, there's a table that mentions potassium excretion and that it's lowest in the morning and it hits its peak in the late afternoon. So in order to obtain an accurate potassium level, it's important to have lab work done around the same time each day to determine a patient's baseline and whether or not they've deviated from it. And now we're back to diabetes. These last 2 bullet points are specifically for diabetic patients. Daily activity is obviously something very important for someone who has diabetes, and a diabetic patient should strive to regularly exercise. And exercise helps by decreasing glucose levels and increasing insulin production. And regular exercise and a healthy diet go hand in regulation of diabetes. Which brings me to my last point about nutrition. The recommended caloric intake for a woman over the age of 60 is 1,600 to 2,000 calories per day. And for a man over the age of 60, it's 2,000 to 2,600. Portion control and limiting intake of added sugars are just two ways to help regulate that blood glucose level. However, if glucose readings are low, it's important to keep something sugary around, whether that's a sugary snack or a sugary beverage like orange juice. And now that I've come to my conclusion and I have talked about metabolic system, all the things that can go right, all the things that can go wrong, I hope you learned a lot today. I definitely learned a lot. This is extremely complicated, but it's really interesting. So hope you guys enjoyed it. It was fun making it. Here are my references, and have a great summer, guys.